Module Overview. In this module, you will explore the structured progression of dementia with a deep dive into the stages of Alzheimer's disease, understanding how cognitive decline unfolds over time. Recognizing these stages allows caregivers to anticipate care needs, adapt communication methods, provide timely interventions, and preserve the dignity of the person living with dementia. The content emphasizes behavioral, psychological, emotional, and physical changes observed at each stage, the appropriate caregiving approaches per stage, and practical techniques for caregivers, family members, and healthcare teams. Learning objectives. By the end of this module, you will be able to identify and describe the major stages of dementia and Alzheimer's disease, differentiate between mild, moderate, and severe stages with real-life symptoms and behavioral changes, understand the 7-stage global deterioration scale, GDS, used by professionals, recognize how symptoms impact communication, independence, safety, and quality of life, apply appropriate caregiving approaches and communication techniques for each stage, prepare care plans according to disease progression, manage safety, behavioral, emotional, and ethical issues associated with advanced dementia. The nature of dementia. Progression. Dementia is a progressive neurological condition, meaning it worsens over time. However, the rate of progression varies based on the type of dementia, general health, environment, care quality, and co-occurring medical conditions. Alzheimer's, the most common form, follows a gradual but predictable path, typically over 8 to 12 years from diagnosis to the end of life. The 3 core stages of dementia. Stage 1, mild, early stage. Symptoms: short-term memory lapses, misplacing items, trouble finding words, mood swings or depression, getting lost in familiar places, difficulty handling complex tasks, e.g., managing bills. Care considerations: encourage independence, create routines, offer gentle reminders, use memory aids, labels, notes, begin legal and care planning. Moderate, middle stage. Symptoms: confusion with time and place, repetition of words, questions, sleep disturbances, personality and behavior changes, agitation, paranoia, difficulty recognizing friends and family assistance needed with dressing, grooming, and hygiene. Care considerations: provide structured environment, reduce stimuli that cause agitation, use visual cues and simple instructions, increase supervision, introduce safety proofing, lock dangerous items, prevent wandering. Severe, late stage. Symptoms: inability to recognize loved ones or surroundings, loss of verbal communication skills, weight loss and difficulty swallowing, incontinence, immobility, or severe physical disability, high risk of infections, e.g., pneumonia. Care considerations: total assistance with activities of daily living, monitor for aspiration and choking, maintain comfort and dignity. Consider palliative care or hospice, emotional support for family caregivers. Causes and risk factors. Age, most common risk factor. Genetics and family history, e.g., APOE4 gene. Cardiovascular issues, e.g., high blood pressure, diabetes, head injuries or traumatic brain injury, TBI. Poor diet, smoking, and sedentary lifestyle, depression and isolation in later life. The 7-stage global deterioration scale, GDS. Developed by Dr. Barry Reisberg, the GDS offers a more detailed breakdown of dementia progression. Stage description. Example 1. No impairment, no memory problems, normal functioning. 2. Very mild decline, forgetting names, misplacing items. 3. Mild decline, noticeable memory lapses, trouble with complex tasks. 4. Moderate decline, forgetting recent events, difficulty managing finances. 5. Moderately severe decline, needs help with dressing and personal hygiene. 6. Severe decline, personality changes, loss of awareness of surroundings. 7. Very severe decline, unable to speak, walk, or respond meaningfully. Functional changes in caregiver adaptation. As dementia progresses, functional capabilities decline. Cognitive, decision-making, memory, orientation, behavioral, aggression, restlessness, hallucinations, physical, motor skills, toileting, feeding, emotional, anxiety, apathy, depression. Caregivers must adapt. Early stages, encourage autonomy, use memory strategies. Middle stages, implement safety protocols, reduce risks. Late stages, focus on comfort, manage end-of-life needs. Safety and ethics in late-stage care. Dignity. Even when verbal communication is gone, respect is essential. Consent. Follow previously expressed wishes. Advance directives. Palliative care. Focus on pain relief, emotional comfort, and spiritual peace. Legal considerations. Guardianship, power of attorney, DNR orders. Practical care planning across stages. Stage care, goal actions. Early support independence. Cognitive therapy. Structure, planning. Middle promote safety. Remove hazards. Assist with ADLS. Monitor behavior. Late ensure comfort. Gentle touch. Nourishment. Music therapy. Skin care. Professional insight. Professionals should continually reassess the stage of the individual and adjust care accordingly. Communication, patience, and empathy are essential as individuals experience fear, confusion, and frustration in different ways at each stage.